Hello everyone. In this video I will talk about DiGeorge syndrome, which is an immunodeficiency disease. Before going to this, just we'll see what is immunodeficiency disorder. So it is a group of disorders in which the defect appears to be intrinsic to one or more components of the immune system. Immunodeficiency disorders are of two types: primary immunodeficiency disorders and secondary immunodeficiency disorders. Primary immunodeficiency disorders are again of three types. One is disorders of specific immunity and disorders of complement deficiency, then disorders of phagocytosis. There are four categories of immune mechanisms: humoral, that is antibody mediated, and second one is cell mediated, T cell mediated. Third one is complement system immune mechanism. Then fourth one is phagocytosis. Among primary immunodeficiency disorders, we have seen there are three types, like disorders of specific immunity and disorders of complement deficiency and disorders of phagocytosis. Among these, disorders of specific immunity, that is B cell deficiency and T cell deficiency, and also both combined B cell and T cell deficiency. It is a specific type of immune mechanism, whereas disorders of complement deficiency and disorders of phagocytosis comes under non-specific immune mechanism. And we will see what is primary immunodeficiency and secondary immunodeficiency disorders. Primary immunodeficiency disorders are congenital, that is genetically defined. And symptoms of primary immunodeficiency disorders, they predominantly appear at an early age, whereas secondary immune deficiency disorders, the onset of symptoms appear at any age. So these secondary immunodeficiency disorders are due to chronic diseases or the effects of irradiation, immunosuppression, then surgeries, injuries, and also due to stress. Major clinical features of immunodeficiencies are if the antibody deficiency is there, they may lead to microbial infections, that is respiratory, maybe pneumonia, sinusitis, etc., or gastrointestinal tract infections like diarrhea. Then it may be because of the deficiency in complement system, complement proteins, that may lead to microbial infections, sepsis, and also various systems may be affected because of the complement protein deficiency. And T lymphocytes deficiency lead to bacterial, fungal, and also viral gastrointestinal diarrhea, respiratory tract infections like pneumonia, sinusitis are the best examples for T lymphocyte deficiency. Phagocytes deficiency lead to abscess and also recurrent skin infections, then granulomatous inflammations, etc. And primary immunodeficiencies may be of humoral immunodeficiencies or cell mediated immunodeficiencies. Humoral is B cell immunodeficiency. This is caused by the improper production of one or all the immunoglobulins, that is antibodies, that results in an increased infections from staphylococcus, streptococcus, haemophilus, and pseudomonas. The best examples for primary humoral immunodeficiency are X-linked A-gamma globulinemia, that is also known as the Bruton syndrome, and common variable immunodeficiency, selective immunoglobulin A deficiency. So these are humoral or B cell immunodeficiencies. Coming to the cell mediated primary immunodeficiencies, we know that T cells control the entire cell mediated and humoral response in an individual. and any deficiency in T cells will affect both cell mediated and humoral immune response. Defects in humoral branch are primarily associated with infections from encapsulated bacteria, and the defects in cell mediated branch would result in infections by intracellular pathogens like Candida albicans, Pneumocystis carinii, and Mycobacterium and protozoans, as well as viral and fungal infections. This indicates the importance of T cells in eliminating intracellular parasites. Coming to the DiGeorge syndrome, this is one of a group of phenotypically similar disorders, including velocardiofacial syndrome and conotruncal anomaly face syndrome. So that share a micro deletion of chromosome 22q11.2, and this 22q11.2, this is the region known as the DGS critical region. This DiGeorge syndrome or congenital thymic aplasia, it is characterized by the absence of thymus gland, which is meant for the production of T cells and maturation of T cells. So with the absence and this associated with its hypothyroidism, then cardiovascular anomalies and increased incidence of infections. Children affected by this disease have an effective humoral immune response against bacterial infections, but they are highly susceptible to viral, protozoan and fungal infections. This is all because of poorly developed or poor functioning of thymus, which is associated with other developmental conditions, and the patients will be having reduction of T cell numbers or absence of T cell response, and also humoral response to T independent antigens only. The DiGeorge syndrome, this is actually happens or it is characterized by the failure of the thymus to develop properly from the third and fourth pharyngeal pouches during embryogenesis. During embryogenesis, this thymus gland is developed from the third and fourth pharyngeal pouches, but in DiGeorge syndrome patients, this thymus is not going to be developed properly from third and fourth pharyngeal pouches. So it is immunodeficiency which is caused by a congenital failure in thymic development, resulting in a lack of mature functional T cells. DiGeorge children also lack parathyroid and have severe cardiovascular abnormalities. Consequently, stem cells can't differentiate to become T lymphocytes, and the thymus dependent areas in lymphoid tissue are separately populated. In contrast, lymphoid follicles are seen, but even these are poorly developed. And coming to the cell mediated immune responses, they are undetectable, and although the infants can deal with common bacterial infections, complete absence of thymus is pretty rare, and more often one is dealing with a partial DiGeorge in which the T cells may rise from 6% at birth to around 30% of the total circulating lymphocytes by the end of the first year. So this is because of mutation of the gene encoding the purine degradation enzyme, that is purine nucleoside phosphorylase, that results in the accumulation of the metabolite deoxy-GTP, which is toxic to T cell precursors through its ability to inhibit ribonucleotide reductase. Patients of DiGeorge syndrome usually suffer, in addition to recurrent infections, neurologic dysfunction and also autoimmunity. Here you can see, so this DiGeorge syndrome, more accurately known by a broader term 22q11.2, because deletion syndrome, because it is a small part of the chromosome 22 is missing in this disease. So this deletion result in poor development of several body systems. Signs and symptoms may include some combination some or combination of the following: heart murmur and bluish skin due to poor circulation of oxygen rich blood as a result of the heart defect, that is known as cyanosis, and also frequent infections because of the absence of T lymphocytes. Then certain facial features such as an underdeveloped chin, low set ears, wide set eyes, or a narrow groove in the upper lip. So these are all facial features that are observed in DiGeorge syndrome patients. A gap in the roof of the mouth, that is cleft palate, or other problems related to palate are also considered in DiGeorge syndrome. Some more symptoms like delayed growth, difficulty feeding, failure to gain weight, or gastrointestinal problems, breathing problems, poor muscle tone, delayed development such as delays in rolling over, sitting up, or other infant milestones, delayed speech development or nasal sounding speech, learning delays or disabilities, behavior problems, etc. Medical problems commonly associated with 22q11.2 deletion syndrome include heart defects, poor immune system function, a cleft palate, complications related to low levels of calcium in blood, and a delayed development with behavioral and emotional problems. The number and the severity of symptoms associated with 22q11.2 deletion syndrome vary from person to person. However, almost everyone with this syndrome needs a treatment from specialists in a variety of fields. Signs and symptoms of this DiGeorge syndrome can vary in type and severity depending on what body systems are affected and how severe the defects are. Some signs and symptoms may be apparent at birth, but others may not appear until later in infancy or early childhood. DiGeorge syndrome, how it is diagnosed is most commonly diagnosed with a blood test called FISH analysis, that is fluorescent in situ hybridization. Treatment to DiGeorge syndrome depends on the organ systems involved. It can involve a wide range of health professionals, includes pediatricians, then cardiologists, geneticists, immunologists, infectious disease specialists, endocrinologists, surgeons, therapists, etc. Different conditions caused by DiGeorge syndrome need different types of treatment. For example, hypoparathyroidism. Treatment includes supplementation with vitamin D or calcium and with parathyroid hormone. Limited thymus gland function can affect the immune system's ability to fight infection, and there may be frequent mild or moderate infections. The immune function usually becomes stronger as the child gets older. Severe thymus dysfunction poses a risk of severe infection, thymus tissue transplantation, then bone marrow transplantation, stem cell transplantation, or transplant of disease fighting blood cells may be necessary for this DiGeorge syndrome. Currently, there is no cure for DiGeorge syndrome, and it is a lifelong condition. The outlook depends on the organ systems affected and the severity of the condition. However, some of the problems tend to improve with age, such as heart and language problems. Most people can expect to live a normal life, but they may continue to experience infections and other problems. Adults with the condition can often live independently. As with most medical conditions, early diagnosis and treatment is essential, and it is also important to attend all medical appointments, as ongoing monitoring can help an individual maintain a good level of health. This is all about DiGeorge syndrome.